So we are going to wait just a minute or so for everyone to get on, and then we will get started. Welcome to our St. Anselm College Family Orientation. This evening is our third of the series for Family Orientation. This session is focused on the important residence life and health services information. All of the sessions are designed to help our families support their new student through their transition to St. Anselm College. My name is Jean Couture. I am the Director of Student Engagement and Leadership, as well as the Vice Chair of the college's new student orientation program. I will be your moderator for this evening. This session will be recorded, and recordings will be available within 48 hours of the session on the college website under the new student orientation page. We encourage participants to use the Q&A feature to submit questions. We will get to as many of those questions as we are able. If you have individual questions, we encourage you to reach out via email to one of several emails that will be shared during the webinar. This evening, your panelists are Maura Marshall, Director of Health Services, and Dr. Sue Weintraub, Assistant Dean of Students and Director of Residential Life and Education. One last opening piece of information. As you likely know from previous sessions, the college is working hard to fine-tune the plan for having our students return to the Hilltop. There are a variety of subcommittees working on these details. These include the specific health and safety measures, adjustments to policies and protocols for life on campus, including in buildings, classrooms, and common spaces, as well as the process of students moving on to campus and the specific dates for that return. I share this so that you are aware we may not have all the specifics tonight, but we are working on these plans, and once established, we will certainly share these details with students. Please encourage your student to check their St. Anselm College email, as that is the official and primary mode of communication the college will use with students. So therefore, without further ado, I now invite Maura Marshall, Director of Health Services, to present.
Hi everyone, welcome to St. A's, and thank you for joining in. I'm just going to share my screen here so everyone can follow along. Okay, so again, this program is to help you know what forms you need, what your student needs to pass into health services, and how you can prepare for the guidelines and the state requirements to get your student to campus, and also to look at the support services we have on campus and how we can help you transition. So health services is typically a walk-in clinic right on campus. We're located right in the student center. Like I said, typically students can just walk in. We're open Monday through Friday, 8 to 6, and Saturdays from 12 to 4. We offer a walk-in clinic like an urgent care. We have nurse practitioners, nurses. We have a doctor that comes in twice a week to offer allergy shots. We have a lab, we can draw blood if need be. We also have counselors under the same roof. We have 5 counselors in health services, and we also have 24/7 on-call for on-call counselors for emergencies. We also provide the health education on campus. Typically, we have CPR classes. We do the alcohol education classes. We have an EMT course, and whatever else other departments may partner with us as the year goes along. When health services is closed, we do have a volunteer student EMT team. They're all nationally certified EMTs. They go on call and respond to all 911 emergencies. So when we're not here, the EMTs respond to emergencies on campus. The cost for health services is covered under the student's room and board. So I say that the cost is free, and students perceive that. So I'm gonna go along with what forms your student needs to get admitted to the college. All of these instructions and forms are located on the admissions portal and the health services webpage. So those are good references. The most important thing your student has to do is connect to their St. A's email. That's how we communicate, and that's how they're going to be able to log into the health services portal and get most of the communication. So if they haven't done so already, please make sure that they've connected to the St. A's email, and if they have any trouble, please have them connect with the help desk. So one thing, health insurance is required for all students at St. A's. It is mandatory. And we do have a student health insurance policy. It's a commercial traveler's policy. It's $3,089 this year, a negotiated full service plan. And that is available from August 1st to August 1st. All students will be charged for that insurance plan unless they are covered under your policy or they have their own policy, which is most students. So if that's the case, you do need to go into this website, www.gallagherstudent.com/St. Anselm, and fill out the waiver. That way, the charge for the $3,000 will come off the student's bill. So make sure if you don't need the student health policy that you go in and waive the insurance. If you do want the student health policy, you do still have to go in and enroll in the insurance. So forms. So everything, like I said, can be uploaded to the portal, the Medicat electronic health record. Students do need to use their St. A's email and access the portal. There's a form they need to fill out, a health admission form that they fill out themselves, and that can be online. Some students have been emailing me that they're having trouble. They have to go in and make an account, and then they get sent a verification email, and they're not getting that verification email. So make sure that they check their junk mail, because in a few cases it's gone to the junk mail. So if they still have any trouble, please just have them contact me and I can talk them through that. But they should be able to access that portal through their email or with their email address. We also need a copy of their most recent physical. It has to be within a year of admissions unless they're a varsity athlete. If they're a varsity athlete, they need to have a physical within 6 months of tryouts. So a lot of times with freshmen, they've had a physical within a year, but not within 6 months. So insurance won't pay for another physical. So if that's the case with any athletes, please have them contact me or the athletic trainer or the coach, and we can get them a physical. Do not pay out of pocket for a second physical in the year. So just we can do that on campus when they get there. The other thing with athletes is they either need to be tested for sickle cell trait or they need to complete a waiver. So that's if you do have a varsity athlete, make sure that they fill out the physical form that we have online, and that's NCAA compliant, and it goes through very specific things for varsity athletes. The only other thing we need is a copy of your insurance card. So again, waive it online, but upload a copy of the insurance card for health services just in case of an emergency so that we have that information. If your student is going to need any medical housing accommodations, and that can be anything, but just to let you know, 2 air conditioners are a medical housing accommodation. Please contact me as soon as possible because we'll be assigning housing pretty soon, and we need to know if your student has any medical housing needs. So privacy. So health services is covered under HIPAA, the federal privacy law that covers the confidentiality of patients because we're healthcare providers. So I think maybe you may hear along the way that there's a form for students to fill out for FERPA, which is the Educational Privacy Act, and then you can get access to their educational records. With the health records, there's no one blanket release. Every time the student comes into health services, they will sign a two-way release to give us permission to share information with whomever they choose, whether it be, you know, their dean, their athletic trainer or coach, you, or their primary care providers, their other doctors. So there's no blanket HIPAA form. They need to fill that out every time they come in. And actually, just to reassure you too, in case of an emergency, if your student was transported to the hospital, HIPAA is out the window, we would notify you. So don't worry about that. If there's an emergency, we will notify the emergency contact. The other thing that's mandatory for incoming students is an online alcohol class and sexual assault class, which is called Third Millennium Classroom. So after today, they will have access to that online course. It takes about 3 hours, and they can come back, but definitely set some time aside this summer to do that course. It's a 2-part course, so the bulk of it is done before they move on to campus. The second part will be in October, and they'll get an email reminding them of that. The second part only takes about 10 minutes, but it measures their attitudes, alcohol, and sexual violence prior to coming to campus and then after they're here. So any students with health concerns, students with allergies, we do allergy shots on campus. So if your student does get allergy shots, all they have to do is have the allergist fax us their prescriptions, and then they bring their serum with them to campus. We keep it in our refrigerator, and then we'll arrange a time during the week to give them their allergy shots. Any students with asthma, I do recommend that they bring their own nebulizer if they use that, definitely their own inhaler, and you know, they can manage that in their room. We do have nebulizers in health services, but it's better for them to have their own. Any students with daily medications, again, they are adults now and they'll keep their medication in their room and they'll be in charge of that, but I do suggest that they bring a lockbox. Unfortunately, you know, sometimes medications may have a tendency to disappear, especially something like the stimulants. As far as prescriptions, if any student needs a monthly prescription, Rite Aid is the pharmacy that delivers to campus. So if that's the case, typically if a student has, we have pharmacies all over the area, CVS, Walgreens, Hannaford, and whatever. They can actually transfer their prescription from their home if they use one of those pharmacies to the Manchester, Goffstown area. But like I said, Rite Aid, they would have to get transportation to that pharmacy. But like I said, Rite Aid is the only one that does deliver, and if students need a medication delivered to campus, it would come to health services and we can help arrange that. So this year, as I've kind of alluded to, is going to look a little bit different than other years, as you're probably aware. So things to bring this year to college, I would definitely make a list of this, is that students will need to bring their own cloth face covering or mask, just something to cover their nose and mouth to prevent droplet exposure to other people. I suggest bringing disinfectant wipes and cleaning products. They're hard to come by nowadays, so it's good for you to kind of start stockpiling those and have your student bring them to campus. They should bring a thermometer, and they should be checking their temperature every single day, if not twice a day, to make sure that they are staying healthy. They should bring their own hand sanitizer. And you also should have a conversation with your student that if they have COVID symptoms and they are going to need to be tested, they're going to have to go into quarantine. We do have a plan backing up. We do have a plan for testing students as they move on to campus, and we're still working out the logistics of that plan. But after they're here on campus, if they should have symptoms of COVID, they will need to be tested, and they would have to go into quarantine until they get the results. So we're going to be having a conversation with them at that time about where they're going to quarantine. Is it going to be on campus, or can they go home? So just have that conversation. If they do test positive, they would have to go into isolation for at least the 10 days, which is the state guidelines now, and 72 hours fever-free. So just to kind of be prepared for that as the time goes on, and assess what's going on in your own household and how that's going to look coming to college. So afterwards, after Sue talks about her, the housing issues, I'm going to be available for questions. Send them in with the Q&A, but also if you have any specific questions about your students and their health needs, please email me and we'll make an arrangement to talk on the phone afterwards and talk confidentially. So thank you.
Thank you, Maura. So I do see your questions are coming in, and we are going to hold off on those. But first we'll answer those after the second presentation, which is Dr. Sue Weintraub, Director of Residential Life and Education. Sue.
Thanks, Jean. Thanks very much. I'm going to share my screen so I can show you my presentation. Again, I'm happy to answer any questions that you have after, and hopefully I'll cover some of your stuff. Like Jean said, I'm Sue Weintraub. I'm the Director of Res Life. I've been at the college for about 20 years. I've been in my position for about 15, and I have responsibilities as Assistant Dean of Students in the Dean of Students office. Residential life is the life of the college that we like to think of that happens outside the classroom. We're not alone in that. We have a lot of our student affairs friends and the activities and campus ministry and those other offices, but generally we consider our main focus to be educating students outside and committing to an environment that promotes living and learning and personal and social development of them. And we try to elicit activities and engage them in peer connections and faculty connections and developing them outside the classroom. For students, unlike high school, something I like to mention, the classroom time and the learning time versus social time coming out of high school and going into college is a little different. A high school schedule, there's a lot of class time during the day, social time and recreation, and and homework and learning that happens in a different way than college. College is 24/7. That's what you get every single week, and students need some help in learning how to be able to transfer that and how to be able to adjust that. And that's one of the things that we see a lot in terms of the Res Hall, because when they come out of the classroom, most of the time, the first year students come into the Residence Hall and they're learning how to negotiate and navigate that social time with learning time and recreational time and adjusting. And that's one of the big things that we spend a lot of time doing and helping them do. And I mentioned we have an experienced staff, I do, to help me do that. So for residential life, we have a professional staff. And professional, what do I mean? I mean, they are educated in career path to do this work. I have 2 assistant directors that help a lot. They are Mike Murphy and Ashley Fletcher. Mike Murphy is in charge of residential operations. And that would be things like, I'm sure you're going to see emails or have seen emails from him. He does all the first year housing matches. He is our housing guru, if you will. He's the one that does all of the housing information forms, and he reaches out to the first year students when it comes to that kind of matching. Ashley, on the other hand, is in charge of residential education, and she's in charge of training our student leaders and training our professional staff to be able to respond to students on campus. Additionally, she's in charge of the education that happens. So she's working with our student staff and our professional staff to offer programming that does some of that personal and social development for students in the residence hall and inviting folks in. So our professional live-in staff, we also have area coordinators and resident directors who live on the floors and in the buildings with students. Specifically for first year students, our resident directors are Shannon Dewar for the women and Connor Peddle for the men. Area coordinators also live in different areas on campus and do the same sort of thing for the upper class students. Again, I mentioned that the area coordinators, and actually also one of my resident directors just earned their master's degree, and they also have bachelor's level degrees, the resident directors, both Shannon and Connor. Everyone's trained in student development theory. Everyone's trained in crisis management, emergency response, higher ed and college policies, higher ed law, building management, and obviously they know a lot about community and campus resources. Our student Rockstar staff is made up of 60 resident assistants. So that generates about a 40-to-1 ratio student to RA. And in the first year residence hall, that's terrific. Your RA, and I put that as the last bullet, I should have put it as one of the first bullets. Your RA is the first contact for students. Get to know your RA. If you're a student on this webinar, that's one piece of advice I can offer you. Your RA knows a lot about campus. There's someone that we've spent time, and we will this summer, training them in what campus resources are important for first year students and other students, what happens and what they should be doing during an emergency situation, how they can assist you, what community building they're going to do to help you adjust and help you get acquainted with the rest of campus and each other and in the building. And like I said, they do a lot of work with first year adjusting to campus and adjusting being away from home, and college transitions, how to be able to advocate for yourself, find the right place on campus, where is this particular thing, how do I transition into a college student. My favorite slide, the one that everyone calls me about, although this year everyone's calling me about a multitude of other things. What to bring to campus. Maura talked about some of the additions to bring to campus this year, most needed, thank you. But I do get called and emailed all the time about the sheet size, which is a real question. Our mattresses will fit sheets that are 36 by 80. And that equates about to a twin XL in most stores. So that's what you want to look for. We have a list of what to bring and also what not to bring on the website. And I also have 2 RAs from a few years back who run through a virtual tour of the first year areas, and they talk you through some of the spaces, and you see how big under the bed is, and you see some of those areas. Really take a good look and watch that tour. It's really a good one, and they do a good job discussing things. They're both terrific at it. I always have this statement on my slide, and this time I decided to use capitals on it. Less is more, because, and Jean talked about it, because we're deciding about what we're going to do about our move-in process. It might be very helpful for the first time you're bringing your student to campus or they're coming to campus, to bring a little bit less. Depending on how they're going to move in and what the requirements are that day, it might make a lot of sense for them to bring less on the first day, and then maybe in time, if that's something you can do, in time, get them the different stuff that they might need. First year areas, So first year students will be in singles and doubles this year. In other years, we have put people in rooms that have accommodated 4 people and rooms that have accommodated 3. Due to obvious health concerns that we have this year, we are only putting first year students in singles and doubles. We're working with the rest of our campus population to make some room on campus to be able to do that. For women, and this is traditional, for women, there are 3 areas and 3 buildings that our first year women live in: Joan of Arc, Alumni Hall, otherwise known as 2nd and 3rd Street, and Baruti Hall. Men traditionally live mostly in Dominic Hall. Some men also live in St. Mary Hall with sophomores. Roommates, the other famous slide that I have. The question that I always ask when I have an audience that can actually respond to me is, how do you think we match our students? What is the question? What's on the housing information form that we tend to look at first? And because I have no one to answer this except my colleagues, so what we first look at, believe it or not, is music. That's a question on there that it's really a really good, solid question that we do our matches from. The other questions that we take a look at are the short answer responses. And we look at those as questions about your feelings of alcohol, your questions about especially how you plan on using your room. How do you plan on using your space in your room? Are you someone that sees it as a very academic space? You're going to study in your room, low music. That's how you see that atmosphere in your room being. Or do you see it kind of being both? Or do you see it just being completely social? I study in the library. Those are questions that rarely change. Some of the things that we find that change are things like bedtime, are things like neat and messy. That tends to either get better or get worse, depending on how that goes. But how you plan to use your room, especially in the first year, doesn't really change. That's kind of steadfast. So we look at those things. Other questions we have about the housing information form and roommates: do you take requests? There are a lot of institutions that do and some institutions that don't. We do not. We really have made some terrific matches with roommates, and there are a lot of reasons why people want to ask for requests. You think you have the same schedule, you've met your best friend or potential best friend over Facebook or over Instagram or whatever, or you want to live with someone from your hometown and you don't want to live with someone from your hometown. All of those requests, or you think you have the same schedule going in. Some of those things work out and some of those things don't. And what we often find, and our research and our numbers show, we do far better when people don't request. Something that I talk a lot about is this with roommates. There's about a 6-week honeymoon period where people are in and they're kind of, I don't want to say walking on eggshells, but they're kind of trying to be the most respectful they can be. Oh, do you want the light out? And they'll shut the light out. Oh, how do you want this? There's a lot more communication. But when someone knows someone, they tend to think, well, my best friend knows that I study at this time. My best friend knows this. Or we have to go and do lacrosse workout practice. Of course he's not going to stay out. These are things that expectations come in after during those first 6 weeks that really make roommates getting along in the first 6 weeks really complex and actually are negative. And that's why we don't. We just end up in such a better place. And to be honest, students meet more people that way. Social media, why did I put that on the list? I put it on the list because we send out roommates of first year students middle of July, and we will be doing the same again this year. I know people are coming back a little early. You'll still have enough time to be able to communicate and do the things you need to do before students need to be back. I wish I could do it a little earlier. I just don't think I can, because so many things need to be in place for the move-in process. But anyway, social media, I would really urge you to not make decisions or judgments on other people's social media accounts. I'll get a phone call inevitably on the Monday. We'll send something out on Friday. I'll get a phone call from Monday from a mom or a dad or a student saying, did you really look at the Housing Information Forum, because this person and me, I don't know how you could think we're going to be able to survive in the same room. And they're making those judgments on either something someone's put on the social media, what they talk about on social media, what their pictures look like on social media. And I would really urge you to really take a look and try to make some communication happen. And if there truly is something that manifests when you come in and you've moved in and you've met someone and you've genuinely given it a try, then yes, we end up taking that and we try to figure out what we can do in that moment and see if a move needs to happen. The next thing, college breaks. Traditionally, I talk about college breaks for fall and spring, but the only thing I can really share with you is we're closing at Thanksgiving. Spring information, at this point for me, I'm still working out. Traditionally, we close our residence halls for spring and Easter. If people need to stay, they just need permission to stay. And for summer break, most of our students leave unless they have a reason in the summer to stay. 3 pieces of wisdom I'd like to offer. It's my last slide, and they're kind of interwoven a little bit. Research shows the greatest indicator of success for students, and this is elementary, this is junior high, this is college, is a student's ability to ask for help. So there's a direct correlation. A student will be successful if there's someone that can ask for help to, give a direction, help to, finish an assignment, help to navigate something they've never navigated before. And that can be a personal or social, instance. It doesn't have to be academic. But what I would urge you to do is start to think about if you're someone that really is kind of quiet, or your student is, and you really are someone that thinks, well, I can do it all by myself. Sure, that does not necessarily mean you're not going to be successful, but you'll probably be more successful if you ask for help. Parents, I ask parents to encourage that independence for their student, to advocate for themselves, to make the call to my office if something's happening. I understand a reason. There's certain times that a parent wants to step in, but most of the time I'm going to go back to the student to talk with them about whatever's happening, because they're the person on the ground and they're the person it's happening with and to. And then the piece of advice I told my kids, and I feel like I need to say, and it kind of goes to the ask for help. Find someone on campus that's your person, an administrator, a faculty member, your person that you go to. There's someone, it doesn't matter who it is. It can be a faculty member, it can be your academic advisor, it can be a dean, it doesn't have to be. It can be your work study boss. It can be someone on campus. And that person knows far more about the college community and the culture than a parent does, and then potentially a student. And find that person. And what I would tell you is, if you feel like, wow, I still haven't found my person, I'd be happy to be your person. I'll be your person. And I'll be your person to be able to help you kind of navigate what you need to, because finding someone on campus that can do that is really, really just probably the best piece of advice I can give you. I think that's about it. That's what I have. I'm sure we have a host of questions, Jean.
Thank you, Sue. So yes, we have a couple questions that came in before, earlier in the day, before we even started the webinar. So I'm going to start with those. And one of them I'm going to answer because I reached out to our IT department to make sure I had the official answer. The question is, what do students need to plug into the in-room high-speed network? Is it Ethernet, cable, HDMI, USB? So basically all student living spaces have the Ansem Secure Wireless Network. So if they have that available to them, if the computer or phone has that ability, which most do today. But if your student wishes to be wired in, almost every single residence hall room on campus has access to a high-speed wired connection. So to utilize this, the student would need to bring a Cat6 Ethernet cord, and also any adapters their computer may need, especially if it does not have the Ethernet port. For instance, current generation MacBooks do not have the Ethernet ports. And so the user must purchase an Ethernet to USB Type-C dongle from Apple is what they said. So if you have more specific questions, you can email help, literally HELP@ansem.edu regarding any other IT questions, and they're going to have great answers for you. So I'm going to go first back to Maura with 2 questions. One is, are students allowed to bring Tylenol and Advil to campus? And the second one is, will the students be able to buy masks, hand sanitizer, disinfecting wipes, etc. on campus once they are there to resupply or supplement what they bring? Maura.
Yeah, good questions. Students are definitely allowed to bring Tylenol and ibuprofen, any over-the-counter medications that they want. I mean, yep, they can bring whatever they need at home, bring with them. I would definitely caution you about thinking that you can buy things on campus, because I don't know if that's going to be available. Supplies are very limited. We just put in a huge bulk order for hand sanitizer, disinfectants, masks, things like that. It's all very hard to come by. So I would definitely, I don't know at this point if the campus is going to be able to supply masks for every single student. I mean, I hope they do, but or hand sanitizer, but I would definitely plan on bringing your own.
So next, couple questions for Sue. I've heard of substance-free residence halls. What does this mean, and what are non-substance-free residence halls? Additionally, there's 2 food allergy questions that I want to have you answer at the same time. One is, are food allergies taken into consideration when matching up roommates? But also, with the change in dining services, what do students with severe food allergies do about housing and eating in the room? They tried calling dining today, but the mailbox was full. And that piece you may not be able to answer, Sue, but I'm going to let you try.
It's late in the day, so I can probably only keep one question in my head at a time. So I know you said substance-free. So the definition of substance-free is no tobacco, no alcohol, no chemical. So illegal chemical. So that's what substance-free is defined as. Are there spaces on campus? Yes. So we have floors in the first-year residence hall that students can select in the housing information form that they want to live there. And then we have that same area in a different building for upper division students. So that's what substance-free looks like. Our first-year res halls are dry. So when it comes to alcohol, sure, that fits that. But it also, for substance-free, it's a little bit more than just alcohol. You talked about, Jean, your second set of questions was about allergies, correct? So one question that I remember you saying, one question specifically was, do we match according to allergies? We don't, because if someone's allergy is that substantial that they wouldn't need a roommate, that request would go through Maura in terms of accommodation request, that they would need a single, perhaps, something like that. But, and Maura, you can jump in at the end, because I know you have those specific conversations with people about their allergies, but generally it's not right for us to ask those questions, because it's not really something that we should know. It's something that really is between your healthcare provider, and we wouldn't do that. When it comes to people eating in the room, whether it be meals or snacks, those are things that we expect the roommates to talk about, and we've really never had an issue. So in other words, if I'm rooming with someone and I come in and say, I have a peanut allergy, do you mind not, eating peanut butter crackers or something in the room? I've never had anyone say, I absolutely need to have my peanut butter crackers. This is untenable. I've never had that happen. People have been really great about it. I don't know if you want to jump in, Maura.
Nope, I agree, Sue. Yeah, if a student has an allergy that they're very concerned with, please, have them reach out to me. We can discuss it. The most common things we deal with are peanut allergies and gluten allergies. And, I say to them, are you comfortable having that conversation with your roommate? And if they are not, maybe a single is indicated, because we can't match, that's confidential health information, and that's not how we match roommates. But if they have the conversation once they are paired with a roommate, and that roommate says, no, I have to eat peanut butter every day in my room, then we can make a switch at that time.
So Maura, I'm going to come back to you. There's a couple COVID testing questions, so 2 of them. What type of COVID testing will you be doing to students? And then the second one, are all students being tested for COVID, and are those tests being completed when students move in, so that if a student does test positive, they will have time for quarantine prior to first day of classes on the 19th? One, actually, the third COVID question, if you can take 3, is if a student has been tested for COVID within 2 weeks prior to arriving to campus, will that be taken into account?
Yep, all good questions. Probably don't have the specific answers yet to all of them. It's all a work in progress. Right now, we are, number one, taking the guidance from the state, which hasn't really come through very specifically yet. We are working, we have very close relationships with Catholic Medical Center, which is the hospital nearby. We have in Clear Choice MD, who will be doing our testing, and also with the Manchester Health Department. So we're all working collaboratively to come up with a plan for testing and what is indicated. We do have the capabilities to do antigen testing and antibody testing when the students arrive to campus. We're still working out logistics with how many we can do per day, when the students are going to be able to move in. It definitely will be a staggered move in, and what exact tests we're going to be doing. So again, there probably will be an allowance for students to get tested prior to move-in. I don't know if it'll be antigen testing within a certain amount of time, antibody testing. Again, we're taking our guidance from the state and waiting for that specific guidance to come through. But we are prepared to do antibody and antigen COVID testing as students move in, working on the logistics of that. And we do have a plan to quarantine students and isolate students who test positive.
Great, thank you, Maura. There's 2 questions which I'm going to answer, and then Sue W. can correct me, and simply because I think she stated it during her presentation. The first one is, with area local states recently informing their students that their curriculum is going to be virtual only this fall semester, many students are looking elsewhere for a college. How can we ensure that our students aren't forced into overcrowded housing at the last minute? So as Sue mentioned, we do, in past years, we have spaces that accommodate 3 triples or quads, 3 or 4 students, but the college has determined that our students in the traditional res halls would be in singles or doubles this year. The second question, since students are moving in earlier, will they be finding out their roommates and housing earlier? As Sue mentioned, she would love to be able to do that, but with all the pieces that we need to get into place, she's not hopeful that it will be any earlier than the traditional mid-July. So please bear with us as we work on these. So this could actually be either Maura or Sue, and it may be one we don't have the answer to. Has anything been put in place for cleaning or sanitizing the dorms, common areas, restrooms, shower facilities at this point. Sue, I'm going to start with you. Do you have any information related to that?
Yeah, I do. I mean, we're having conversations about exactly how to be able to sanitize all of those common spaces. Bathrooms are going to look different. We're adding probably some paper towels. We're adding cleaning product in those areas. I have a meeting this week with Physical Plant to determine exactly how and how often they're going to be cleaned, but they will, yeah.
Okay.
So
Well,
we're in the process of doing that.
great. We're going to stay right on Sue. I'm planning to bring a storage unit for under my bed. What is the height and length under the beds in JOA?
No, Lord, okay, about 12 inches. So, and the length is, again, 80 inches.
Another one, Sue, stay right there. Are bed risers included?
Included in what I provide, or?
Yes, in the room.
No,
Yes.
no, bring them with you. Just don't bring cement blocks. Bring the good old fashioned plastic bed risers. They will last you and they'll be great, but not cement blocks. Plus they look nicer.
So, Maura, will the flu vaccine be available to the students in the fall? And then, yeah, go with that one for now.
Yes, yep, we always have a flu clinic, usually mid-October for students. Yep.
So here are some some of these we don't have answers to, folks, at this time. Are parents going to be able to move us into our residence halls? We are still working on those details of what move-in will look like. So, because there was another question up here, when move-in occurs, it's obviously going to be different from previous years. How much time to move in and situate our incoming student? Once again, we're still working on the details, so please give us a little bit more time. We will certainly get that information out to students as soon as we've situated what that exact plan looks like over a 10-day, period, is what we're kind of looking at so far. So, Sue, will honor students still be placed in Joan of Arc?
Yes, they absolutely will be placed in Joan of Arc. And there is a contingent usually, although I haven't looked at the forms, that are both honors and sub-free. And if we have enough of those students, that combination, they'll also be on their own wing. But yeah, honor students will be placed in Joan of Arc and a wing in Dominic.
So, Sue, I'm going to stay with you. You mentioned only bringing the minimum when moving in initially, and then possibly bringing more items later on. Does that mean parents will be allowed on campus after move-in? Will students be allowed to leave campus, especially for Labor Day, Columbus Day?
Those are great questions. And like Jean said, it's not that we're trying to be cagey. We're really working out some of the details so we can offer that to everyone. I will say that as I go into those meetings, I'm going to try and, to limit how many people are entering the residence hall. Will parents be allowed to do certain things? Potentially, but in terms of bringing things back, there might be a scenario that it's only the students that are carrying things up into the residence hall, just to provide that safety and just so, we're not exposing a lot of students to a lot of different people over a short period of time. Students will, one of the questions you asked, will they be able to situate, them into their space? And that's part of what I'm thinking too. How can and will that happen? I don't really love the idea myself. I have a junior and I have a freshman. I can't imagine throwing my kid in a res hall and be like, see how you do that. But I've really got to consider, I got to consider everyone's safety. And like Jean said, as soon as we figure out how we're going to do that, we'll let people know. In terms of travel, I know that we're going to try to limit and consider travel on and off campus as necessity. So, it's certainly not, we're not going to stop the gates at the door and say, no, you cannot leave. However, we're going to strongly urge people to consider what's a necessity and in terms of students coming and going all the time.
Thank you, Sue. And to add to that, for instance, I do know that Labor Day will be a class day for students. So that's obviously a day that they wouldn't have an opportunity to leave campus, even if we determine that that would be allowed. And once again, we're still working out those different details. Another one that ties to that, which I'll just answer, if a student moves in on the 9th and classes start on the 19th, is that student staying on campus, or do the students leave and all new students return the same day? The idea is that once they move on to campus, they should be staying on campus or in the local area only. Our goal is not to have them traveling outside the local area, and really as few trips as possible off campus. Once again, we're working on those details, and the students are going to get specifics about policies, protocols, and what these processes are. Another question that I'll answer: where do they find out which classes they are registered for on the portal? So if they log into their student portal, there's going to be a link, I believe, to the registration page that will then, where they register for classes, and that's where they'll be able to see what they're already registered for. So it's the student's login. They need to log in themselves. It's not something that you as a parent can find for them. They do need to do that. So if they're going into the portal where the orientation, the admission portal where the information is, it should be there. Actually, I'm getting a little bit of a clarification. The My Ansem portal and student should participate in online orientation. So yeah, your student has received an email about their online orientation through their ansem.edu email. They should read that. That's going to lead them to the admission portal, and that's also going to give them all this information in regard to registering for classes and where they can find out what they're registered for. Okay. Sue, whoops, I just lost it. So 2 questions. Can I request a non-bunked bed room? And the other one, sorry, I did lose it. I want to get back to it though. I apologize, I don't know where it went. So Sue, why don't you go ahead and answer that one?
Sure. Because we're doing doubles and singles, most of the rooms you have a choice of bunking your bed or not. And because we're not having rooms that are triples, it'll be really easy to be able to have a room that has 2 beds and no one has a bed that's bunked.
Sue, we'll stay with you. Are students allowed a mini fridge in their res hall room?
Yes. It'll be 2.7 cubic feet, so no taller than like an adult hip. It can't be like an apartment fridge. It's got to be a real, it can be a lower fridge, either a cube or, one that has a freezer that's really kind of small.
Okay. Maura Marshall, what do you do if doctor appointments for physicals have been delayed? Additionally, if a student already tested positive for COVID-19 and has been cleared by the Department of Public Health to leave quarantine isolation, but is still testing positive, what documentation should they bring?
I guess I don't really understand if they've been cleared by the Department of Health and tested positive. Again, we're still working out the policies and procedures, but I would assume that if they've been tested positive and they've been cleared, that they will be allowed on campus without further testing. But again, we'll come out with some very strict policies in regards to previous testing, antibody testing, and tested someone who's already had COVID. And what was the other question?
What do you do if doctor appointment for physical has been delayed?
So ideally, everyone should have a physical within a year of coming to campus. If you're unable to get a physical before moving on to campus, again, please contact me. If it's an insurance issue, we can get the physical done on campus. If it's not an insurance issue, it's because the doctor's office is doing telehealth and not able to make an appointment, then try to go to an urgent care in your area, just so that it limits the confusion moving on to campus too with the paperwork. But you just reach out to me if there's any specific questions.
Right. So I'm going to answer a couple of these because I feel like they're tied in, but will the parents be allowed on campus to move the students in? We're looking at specifically who will be allowed to go up into each of the residence halls, so more to come on that. Is there a move-in date? Once again, we haven't established specific dates for each student, but that date could be different for every first-year student. So more to come on what that looks like, and your students will receive that information, the particulars around that. Are parents allowed to mail a care box / package, including supplies they may need throughout the semester? That's fine. A package, they can receive a package through the post office on campus. I don't see any issues with that. So once again, this one we're determining, will students be allowed to spend a weekend at home once the semester begins? Once again, we're really encouraging that the students are limited in where they travel to off campus. Some of it will be at their own choosing. It's not a locked campus, but we really are going to be talking through with them what we're hoping to do as a community, and policies and protocols that will be in place. Maura, I don't know if I think actually, yes, you should be able to answer this. Do nursing students need any specific vaccinations prior to the beginning of the academic school year?
So not for freshmen. Going into sophomore year, they have different requirements as far as titers. They need to have a hepatitis B titer and a varicella titer, flu shot, things like that. But coming into freshman year, it's the same for all incoming students.
And will hand sanitizer stations be around campus?
Yes.
Great. I believe Sue answered this already. Will singles be in doubles and doubles in triples? Sue, do you want to clarify that a little bit maybe? Will singles be in doubles and doubles in triples? And I think they're talking about the space.
So late in the day, that's like a tongue twister. So we have single rooms that are singles, and they're singles this year, there'll be singles next year, and there were singles last year. So single rooms for one occupant. We have double rooms on campus that are doubles. Any of the triple rooms that normally we would have 3 people in will be doubles. Any of the rooms that we would normally put 4 people in, like for example, in our building, Alumni Hall, 2nd and 3rd Street, we have a lot of quads that are true quads. There'll be 2 people in there. So I hope that answers the question. So single rooms will not be our old double rooms. It won't look like that. Single rooms are single rooms, and double rooms are double rooms. But the double rooms now have changed from triples and quads into occupancy of 2. Is that clear?
Yep, that makes sense. So here's a question. Making sure I understand, the students will be given a date to move in sometime in a 10-day window. For the families that need to fly into New Hampshire and book travel, is there an estimated date on when we know? We are working, so there is a subcommittee working, and that move in and those dates, that whole procedure is a high priority. And we do know our students from a distance, and those that have to fly in, those are the ones we are working to get that information out. And hopefully we're going to get that either by the end of the month or very early July. So it's on our radars as a high priority, and we are working on that to get that information as soon as possible. So we are, at the hour mark. I'm going to glance through and see if there's pressing questions, but certainly we're going to answer these. If it didn't get answered, you can email either Sue or Maura or myself. Really quickly, is there any shuttle bus transportation to places like CVS or the mall in Manchester? There is a local bus that comes onto campus every hour, and there's 2 different bus stops actually on campus. So it's part of the Manchester public transportation system, so that is available to our students. Maura, I'm going to let you, once again, this could be Sue or Maura, but I'm going to go with Maura on this one. Can students bring a spray bottle of bleach mixture labeled if they cannot find disinfecting wipes before moving on to campus?
Yeah, I don't think there's any issue with that. You know, spray disinfectants, there's no issue. Again, I think it's a good idea to have that conversation with your roommate just to make sure they're okay with it, but certainly a good way to disinfect, and however you can get disinfectant is a good idea right now.
Okay. Maura, I'm going to stay with you because I'm not sure you actually have the answer, but if you could please respond. How about commuter students integrating with on-campus students? Will commuter students be tested daily as their exposure level is different than those on campus?
Yeah, again, we're working out the details with commuter students. They are different because they're not living and staying overnight on campus. So we're really going to be looking at them like employees and working out the employee policy for daily screening, and probably going to kind of parallel commuters with that. There'll definitely be social distancing in the classrooms, but the commuter policies are going to look a little bit different than students that live on campus and spend the night.
Okay, we're going to stay with Maura. If a student has results already from antigen/antibody testing, would you like that in advance?
Yes, that would be great. Thank you. And again, there'll be definitely very specific policies coming out and guidelines for students who have already been tested, and what the protocols are going to be as far as waiving the testing moving in.
Great, thank you. So folks, there are some questions I didn't address, we didn't address specifically, but please know there are additional sessions, and some of them, there's going to be an athletics session. There's also going to be a student engagement session. So I think some of those questions will get answered during those sessions. But if you want an immediate answer, you can either reach out to us, and we'll also work to answer these in different avenues. So thank you so much for all the questions. Thank you for joining us. We do encourage you to reach out. It's Maura Marshall at anselm.edu, residenceLife@anselm.edu, orientation@anselm.edu, academic advisement @anselm.edu. Basically, you've got a whole team here to help you. There's a whole bunch of other anselm.edus I could provide, but don't hesitate to ask the questions. As a reminder, tonight's session was recorded, and recordings will be available within 48 hours of the session on the college website under new student orientation page. We look forward to seeing you at our next family session, which is June 17th, and it's on the topic of academics. Thank you so much and have a lovely evening.